So good afternoon. Thank you all for coming. This is our typically monthly care services meeting. We are webcasting live on YouTube. It'll be there for you to watch again later if you want to, or go back and replay certain sections. I think it's appropriate that we mention the recent FDA approval of a potential treatment to slow down the progression of ALS. So that's not our topic today, but we have provided you with handouts. There's been a lot of emails sent on this topic to our email database in the last few days. We'll continue to keep people updated. We have material from the drug maker on the table, and those same materials have been distributed electronically and they're available. So with that said, we're going to turn over the presentation to our guest from Maxim and let them present our scheduled agenda. Okay?
Thanks, Keith.
You're welcome.
Yeah. All right. Well, thank you, everyone, for having us. Can you hear me? Is this thing on? Yeah. Yeah? Okay. Thank you also to Life Pro Financial for having us today. We are here to really have an open discussion with everyone. I want this to be, as you have questions, ideas, comments, bring them up. No need to wait till the end. I just want this to be super friendly and super engaging. And basically, we're going to be actively trying to get you to participate in some questions so that we can get an understanding of where your experience has been with accessing reliable care in terms of respite. A little background on myself. I don't have personal experience with ALS in my family, but I lost my mother when I was 16. Started taking care of my grandmother for about 3 or 4 years, and so I've built a really strong sense of empathy for this lifestyle of being a caregiver and having kids and college and work and that balance. So Keith and I were talking, and the reason why I wanted to present to you guys today was because I know it can be a challenge to find reliable caregiving. The affordable piece is getting harder and harder, and that's unfortunately going to continue to be the case. And to just provide you with some industry knowledge from people that are in this industry every single day. So without further ado, my name's Martin-Greene, and I am the Business Development Manager for Maxim Healthcare in San Diego County, and this is Mike Palomino, and he is the account manager for our non-medical division. Here in San Diego, we do skilled nursing care, so we do hourly care for individuals that have feeding tubes, breathing tubes, tracheostomies, ventilators, oxygen management, all the way down to that level of just companionship and assistance with ADLs. Okay, so let's just dive into it. I want to know, what is everyone's experience with caregiving and finding that resource by yourself? Has anyone had?
We just found out my brother has possibly ALS.
Okay.
Zero.
Zero experience yet?
Zero.
Okay. Has anyone else had challenges trying to hire or privately pay for caregivers?
I haven't needed it.
Haven't needed it yet?
I have some questions in my mind about things that might come up.
Okay. Sure.
We haven't required anything like that.
Okay.
Because he's fairly new to
Okay. So the response was that from 2 people so far, haven't really needed it yet. But there are some questions related to just the aspects of searching for it maybe and where to find it. Okay. You haven't needed it yet? Okay. Okay. Yeah. It's when I was going through it, when I was 19 years old, going to school in Cal State San Marcos, and I was driving back every weekend to take care of my grandma in LA. And it got to a point where I couldn't do that anymore because she needed more support than that. So I know that it's a struggle to try and go on Craigslist and to try and find those resources yourself. It's doable, and it's just something that I know Keith has shared has been with this population. It's been a struggle. So we'll kind of get into that a little bit more though. Well, since no one's really had experience with that, my experience with home care has been when you meet someone and you allow them into your home, it can be tough. It can be hard to open up like that. So I would suggest you put your foot down. It's your home, and try and set that boundary of you want to meet that person first, because I know it's hard if you're in a situation where you're desperately in need of help and you just want someone to come. It can be challenging. But do some interviews. Try to get to know the person a little bit, because after all, they're going to be taking care of your loved one. So one of the main things we're going to talk about today, time out.
So could you expand on that? In other words, do you ask for referrals? Do you do background checks in a private, let's say you're on Craigslist and you get a name and it didn't come from another family, or maybe it did. Mm-hmm. What do you do to check this person out?
So I could probably elaborate more on that, and thanks, Jake, for kind of bringing it into it. Just to kind of give you a little bit of background on myself, my name is Mike. I've been the account manager with the company for about 8.5 years now here in San Diego County. So we've provided care for a lot of individuals, not all with ALS. We certainly have some patients that we care for currently, but we provide in-home companion care support for people in their home. And just to kind of answer your question, we do run background checks. For a long time, the home care industry here in the state of California has been known as the Wild Wild West, essentially, because there's been no governing agency that audits home care companies. Anybody with a business license could go ahead and open up mom and pop home care company and just hire anybody off the street and say they run background checks, and I can go ahead and have Susie Q go take care of your mom. Yes, we run the background checks, when in all reality they could or they couldn't, and there's nobody checking to see if they did. So last year there was a bill that was passed here in the state of California. It's the Home Care Services Act that was passed, and that created the Home Care Services Bureau here in the state of California. And what this organization does is it audits non-medical home care companies to ensure that they are running the live scans, the fingerprints for their employees to provide care in your home. And they're also making sure that they're registered with the state, so that if you ask that individual, can I get your registration number, and they give it to you, you should be able to type it into your computer on the registry and see that that person, yes, has a background check and they're licensed with the state of California. That just happened. Obviously, home care has been going on for a long time, and before that, there was an organization called the American Board of Home Care, which I was the chapter president of here in San Diego for several years, and that organization really kind of banded together certain home care companies in the area that were very transparent with their background checks and their licensing and all the credentials that make that care provider suitable in somebody's home. Now, with the creation of the Home Care Services Bureau, we're really partnering with them to make sure that they're doing the checks and balances on other home care companies to make sure that whoever's coming into your home to provide care has a background check run. So we only talked about background checks. I'm sure there's a lot of other questions out there of other things that companies do to ensure quality assurance when having a caregiver in the home. And I'm just going to kind of go over a few pros and cons of different models that you could actually hire from. So if you're going to have somebody provide care in the home, you could either hire somebody privately, which is all that is a family friend, a neighbor, somebody off the internet that you want to go ahead and pay yourself. Most likely it would be under the table. The other option would be to go through a registry. I'm sure everybody's heard of care.com. If you go on care.com, you can see profiles of individuals. They go ahead and they actually run the background checks. However, when they go ahead and place somebody with you, you are still the employer. So you have to make sure that you're doing the things as far as doing the payroll taxes, making sure that you have the insurance in case something happens to them in your home. A lot of people think homeowners insurance covers something if that caregiver falls and injures themselves. That's not always the case. Actually, most of the time it's not. So that's one way to go ahead and do it. The price, as I'm kind of talking, the price kind of goes up as far as the cost of a caregiver. But Care.com, not knocking it at all. It's a great service to have. Just educating everybody to know that they go ahead and basically find somebody for you. It's up to you to employ that person and then take it on from there. Once you hire that person, and let's say that person calls off sick, something's going on, you can't call Care.com to come in and help you out with things. They already did their job. They found you somebody. The last option is going through an agency. So, Maxim Healthcare Services, that's the type of model that we have. And we not only, of course, run the background checks, make sure they're licensed with the state of California, but we also manage the care. And what I mean by actually managing it is we have a team of healthcare coordinators in the office that ensures that your schedule is up to date, that there's somebody there when you need them. I can probably imagine that everybody in here is probably called off sick of work maybe once or twice in their life. So it still happens in the caregiving industry. So if you have somebody on your own and they call off sick, there's not much you can do, especially in a last-minute situation. With us, we have a team of coordinators. We have a pool of qualified caregivers to call at a moment's notice. We're available 24/7, and we could possibly have somebody out there to replace your original person that was scheduled. Another thing that's tough that many people don't think about too often is, what do you do if things aren't going so well? Maybe it's certain things that you ask that person to do. Maybe they're not following directions that well, or maybe it's just not the right fit chemistry-wise. I mean, it's a service. It's a people business. We have people that provide care. Susie Q could be providing great care for this gentleman over here, but then it's just not really the right fit over here. So we try to do the best we can to play the matchmaker. We do a comprehensive assessment in the home, kind of ask if you were to paint that perfect picture of a caregiver, what does that person look like? And then we go back and look at the pool of individuals that we have. We cover the entire county of San Diego, so obviously we take a few things into consideration. Where do they live versus where does the patient live? What are their qualifications as far as the needs of what they're going to have to do? And also to what is their availability? What are the schedules that they're available for versus what you're asking for? So those are just some of the things that an agency does that you might not think of right off the bat. Something I didn't really cover on the other two models. Again, I'm not advocating one or the other. Just know that there's pros and cons for each. Really, the only con with going with an agency like us is it costs more, because it costs money to employ the coordinators in the office. It costs money for the overhead, for all the insurances and background checks that we have to run. Obviously, that's all covered with the service here. When you're talking about employing somebody on your own, let's say everything goes great. The caregiver has been phenomenal. Things are going wonderful. That caregiver, for whatever reason, leaves, or maybe you don't need that person anymore. There's nothing stopping that person from going to the unemployment office and saying, I don't work anymore. I'd like to go on unemployment. They'll ask, where did you work? Mrs. Smith down the street employed me for the last 3 years. They'll go to Mrs. Smith. And if she did everything correctly as far as file proper payroll taxes and all that stuff, they're all good. But from what I've seen, for the most part, it's a lot of the private hires are just under the table cash. And unfortunately, they would get slapped with a pretty hefty fine from the government and have to pay all those payroll taxes back. And it's not a good situation. So any questions on the actual three models of what I just spoke about as far as hiring a caregiver?
How do you guys find
Hold on.
We're going to get a microphone over there real quick.
How do you guys find and recruit caregivers for your services?
Great question. How do we find and recruit caregivers for our service? So we have a number of ways to do so. We have 9 dedicated recruiters in our particular office here in San Diego. Maxim is a nationwide company. It slightly varies from office to office, but we use basic tools as far as online job posts. Career fairs are huge. We have a lot of existing relationships with vocational nursing schools here in the area for certified nursing assistants, home health aides that provide the non-medical care. So we'll go to their career fairs and ensure that we have a steady pool of qualified people coming through.
So are they all registered nurses, or some people specialize in ALS, or what's the deal there?
Yeah, so since we do have a skilled division that we offer skilled care as far as having RN and LVN level care, yes, we also recruit nurses. As far as the non-medical care, it's more of the CNAs, HHAs. And as far as their experience level, we really kind of talk to them and see exactly what experiences they do have. When we're going out and doing an assessment and there's a lot of personal care and transfer assistance and ambulation assistance and meal prep, if we have somebody that just is on board to work with children, we're not going to send that person out, obviously. If we have somebody that's been working with ALS patients, maybe patients who have used a Hoyer lift or certain other transfer techniques that have been learned, we're probably going to go ahead and talk to those individuals and make sure that's a good fit for you guys. And at the end of the day, it's our job to make sure that they're qualified, but that doesn't always ensure that they're going to have the right chemistry fit. So that's why we allow complimentary interviews with the family to ensure that you're okay with this person providing care for your loved one. With us, and I'm sure I can speak for other home care agencies out there, is if things go bad or don't work out, or somebody's late, or there's obviously employment issues, we can do all the checks and balances we can possibly do. But if we find out that a caregiver is just late and not doing a good job out there, we're probably not going to have that person go out with any other family. So as we've been here in the area for 15 plus years, and we've created a steady pool of great candidates. We've had people on board with Maxim for 10 plus years.
10, 20?
Yep.
I think in San Diego County, we have about 1,000 RNs, CNAs, home health aides, and LVNs in our pool, and about 500 of those are active currently. So, that's from the California-Mexico border all the way up to Riverside and Orange County. On the skilled nursing side of things, if we don't have a nurse that fits the needs of a 2-year-old on a ventilator in Escondido, we'll call our Temecula office. Vice versa with Camp Pendleton, we might call the Orange County office, and we share a lot. But today we've got some recruiters at a job fair, and that's been a huge source of finding good candidates.
One last question, then I promise I'll stop. So it's expensive, and with ALS it progresses, right? So there's times when you're going to need it more than in the early times. Mm-hmm. Are there classes or things that we as intermediate caregivers could do or take until it gets time to pass it on to you guys?
Yeah, if I were to give any advice or suggestions, I'm sure Keith would probably be able to give you a little bit more insight on ALS
specifics.
Yeah, like certain classes that.
I've got about 3 things.
Yeah.
Yes, Sharp Scripts do a phenomenal job with caregiver training. The Red Cross does. I have a whole list of them. So we find geographically convenient for you, and there's wonderful training available. Some of it's free, some of it's a nominal fee. It's terrific. They have actual rooms set up, so you can actually do, some of the lifting and transfers, real, and so those resources are there. We'll share those with you and make sure you have access to them. Back to the hiring from Craigslist or even an agency, it doesn't matter. Up front, everybody needs to agree on the care plan. Okay, if a caregiver comes in and watching Gone with the Wind with you, that's not what they're there for, okay? If that's what you want them to do, but really there's a care plan that's established. In some cases, it's helpful to have it posted, at least initially. This is what is expected throughout the day, and here's why you're here. When you're working with an agency, they do that for you, and a lot of agencies will actually monitor and check. Yeah. If you're on your own, you're on your own. We did have a family that hired. They worked out a room and board exchange for the caregiving. Cash payments for occasional hourly rates above and beyond what the room and board was worth. They filed a suit with the Department of Labor and sued the family. There were no records. There was no proof of any payment. There was no contract for the room and board agreement. So this gal, and then she actually had her boyfriend move in with her, were there for months, minimal caregiving done, and then sued the family, and they won. So don't do it wrong. California's tough. Department of Labor, the whole thing about unemployment. If you haven't done all that, they're coming back. So just a little lesson there. Now I'll pass it back to our presenters.
Yeah, I think do explore all options. I think everyone's going to have a preference of their own. For me, when I hired privately for my grandmother, it was fine for a long time until we started noticing situations that we weren't liking as a family. But it was fine for a long time. I think, like Mike said, there's pros and cons to both. And I would just do your research and get to know the company, if you go with an agency, I'd say we would love to have you come to the office to see how we do things, because it's always nice to see who you're working with. Yeah.
Just two questions. Residential care facilities and skilled nursing facilities have medical directors. Do you guys have a medical director
Yes.
with Maxim?
Yes, we do.
Oh, okay.
Yeah. Our director in San Diego County, she's been here for 14 or 15 years.
Mm-hmm.
She oversees all of our clinical stuff.
Okay, good.
Yeah.
And then the other, you're probably going to discuss costs and so forth.
We will.
The cost depends on the level of care needed, and it just progresses, or is there a set?
It would be a set rate. The cost will be associated with the skill level of the caregiver.
Okay,
So
right.
from a home health aide and CNA is going to differ from an LVN, which will
So
differ
it's all
from-
going to be dependent on the level of need.
Yeah,
Okay.
correct. We have families who, from one opinion, could maybe use just a home health aide, but have had bad experiences, and they want a licensed professional in there who's gone and done a couple years of schooling. That's a significant difference. But if that's what they want, we can do that.
Okay, thanks.
Yeah.
And I'm sure everyone wants to know, how much do these services typically cost as far as having a caregiver in the home? Well, with a private hire, you're looking at anywhere from $11.50, which is right now the lowest wage that you could pay. Probably anywhere it's about $18 an hour. If you go through a registry, which is a company like care.com, you're basically paying a fee on top of that. So you're looking maybe $20 for, $21 if you go through a registry model. For us, it's going to be about $25 an hour. And I'll be honest, costs have risen a lot over the last 3 years. A big reason is because of the wage increases, particularly here in San Diego, but also a big reason is, the Home Care Services Bureau requires us to pay fees and to obviously we've always done the background check, so there's no additional cost there, but it's the licensing fees that we now have to pay the state of California, which the overhead goes up a little bit. So it's those things that have driven cost up a lot, and that's pretty common. $25 is really common for any agency out here in the area.
4-hour minimum?
Well, thank you for the nice lead into that. Industry average right now is in the, like Mike said, 25, 26, 28 range, and usually people are asking for a 4-hour minimum. Because of my experiences that I've had in the last couple of years with PALS, because of my experience as a caregiver myself, I talked to Mike as the manager of the division, and we agreed that we would offer anyone that went through the ALS Foundation to try and get services from us, we would do a 2-hour minimum, just because that's what a lot of caregivers are really looking to at least work a couple hours, and we're only going to charge $24 an hour for a home health aide CNA level. Maxim Healthcare, I didn't want to talk too much about us, but we will. The beautiful thing, I think, is that there's a few of us out there that offer that whole continuum of care, from the non-medical caregiving all the way up to the trach and ventilator care, if that's where we get. So when you get up to that later stage, you don't have to switch agencies, or you don't have to switch directors or points of contact. That would just be sticking with one company, which I think would be a nice thing.
How does the insurance, if someone has insurance, how does that come into play?
Long-term care insurance and private pay are the two funding sources, I think, as it relates to this group here.
Right.
We work with workers' comp. If there was an injury on the job, they would fund some non-medical caregiving. Unfortunately, Medicare does not cover the hourly care. They'll offer intermittent visits, 4 hours at a time for an RN or a social worker, but for hourly care, it's going to be private pay or long-term care insurance. And we're contracted with darn near every long-term care insurance out there. But that's one of those things where you have to be forward-thinking. I don't know if a lot of people have long-term care insurance, and then obviously I think with a diagnosis of ALS, it might be too late. Otherwise, the premiums are going to be crazy.
Okay, thanks.
Yeah.
Mm-hmm. Yeah, so it's unfortunate, but those are really only the two options as far as the non-medical care goes. Does anybody here have a long-term care insurance policy? You do? CalPERS long-term care?
They recently sent us an email about this licensing issue, and sometimes it's kind of hard to understand, the choice of words. It gets very kind of legal.
Mm-hmm.
But it sounded like we would have some coverage for a licensed caregiver, like you're offering, as near as I can tell. But I couldn't really determine how much, but I think we would have some.
If you have, my email's on my card. Mm-hmm. You're more than welcome to either forward me a copy. I think it's called the face sheet, or the elimination.
It's the assignment of benefits?
Assignment of benefits, thank you.
What's it called again?
Assignment of benefits. It'll talk about your elimination period, which is how much you'll be responsible for before the long-term kicks in, your daily allowed amount, and it'll have all your information on there. But even if you want to forward me a copy of that letter, I can kind of dig through it and see if I can.
I may have. It may be gone. I'm not sure.
You're more than welcome to, though.
Right.
Okay.
A lot of people have the policy just to supplement the care as well. The insurance can be pretty expensive. So, that's awesome that you have a policy, and that's certainly a way to cover the service.
And it also works for skilled care. So if you got to the point where you wanted a licensed vocational nurse or an RN, what it comes down to is if you'll have a daily allowed amount of, let's say, $200. If you were charging you, let's just, for easy math, say $25 an hour, you would just divide 200 by $25 an hour, and you would get 8 hours of care for the day for a non-medical caregiver. If you jumped up to 50 or 45, let's go with 50 for the LVN or RN, it drops accordingly to 4 hours per day. But that's how that piece works.
So back to insurance, if we may.
Yeah.
I'll just step aside a little bit and talk about life insurance. If you're recently diagnosed and you're successful with most of your daily activities, talk to a broker, talk to an agent. Don't think that you can't get a policy.
Yeah.
The earlier you do it, obviously, the better and the less expensive, but there are policies out there for people with an ALS diagnosis. And I'd ask the same questions about options on long-term disability. Let the brokers do their job and give you options. Okay, don't just assume that you can't get it or it's going to be too expensive.
Right.
Let them do the math.
Right. So a lot of people think, LTC policy very expensive. As I just mentioned, you don't have to have an expensive policy. You can just have a smaller policy to help subsidize the cost if you need it in the future. So it's a pretty bad stigma that this type of insurance has, for the most part, is its expensive premiums.
What's the average number of hours? I guess I know it depends on obviously the level that you're at, but is there kind of an average, like
No.
8, 10?
For the insurance, or for just a family requesting care?
Family requesting care for someone living with
Completely
us.
up to you guys.
Yeah.
So when we go ahead and do the in-home assessment, we're going to go ahead and really talk about the needs. Talk about what do you need out here? What do you need help with? I'll be honest, I was on the phone before I got here with a woman that has her father in the house, and it's a cognitive impairment situation where she needs somebody there when she goes to work. So, for her, it's Monday through Friday, 9 to 5. Somebody else can be completely different. So there really is no norm as far as the hours go. So it just really depends on the family support system, the family dynamic as well, or there are people nearby that can help out here and there.
And there's no daily limit or required amount either. Okay.
So one of the reasons the 2-hour minimum versus 4-hour can be so helpful is some folks simply need help first thing in the morning to get out of bed, bathed, fed, and they can be relatively independent until it's time to go to bed. So 2-hour in the morning, 2-hour at night, some people's perfect world for as long as that works. And then if things change, they change. But when you're facing a 4-hour minimum and you only need an hour or two in the morning, that's where it gets expensive.
That's where it gets to be, gone with the wind time, right? One thing I know Keith asked when I first got here is, man, if I have a stranger in my house, what's stopping them from stealing something? So, obviously that's something that we try to, limit. We, of course, run the background checks. And when I mean background check, federal, state, sex offender, DMV,
OIG, Office Inspector General.
Office Inspector General, everything, and that stuff gets run for our agency every single month. So the state only, I think they make you do it once a year. For us, we do it every month. So if we hire somebody and, God forbid, they commit a crime while they're working for us, we're going to find out when it hits that month and we run it. Fortunately, I don't think that's ever happened for somebody being currently on board with us, but just know that those protections are there. If you hire somebody on your own, there's no problem with that. Just know that you're going to be the one that needs to go ahead and run those background checks. Going back to the theft, we have all the insurances and things like that. We try to guard against that. Sometimes there's some mean-spirited people out there, and they found their way through the system, and if they if we find that they stole something and they're part of our company, then we would cover that for you. Hopefully it's nothing crazy, but fortunately I haven't been, I think it's maybe once or twice in the 8 years that I've been working for this company that there's been somebody that actually stole something. So we try our best to make sure that that doesn't happen. And, I think you asked about the onboarding process earlier. We conduct thorough interviews and call their references for the previous places that they worked. And at the end of the day, as far as being a non-medical provider, there's not a lot of schooling that you need. Obviously, there's some techniques and things that you've learned in school as far as transferring and ambulation assistance that we look for. But we want to make sure, is this person doing it for the money, or is this person doing it because they love to care for people? We have experienced, coordinators and recruiters in the office. They've been there for 6-7 years, and I think they're really good at, talking to people and reading somebody and hopefully making the right decision about bringing that person on board.
And the person that's going to come out to do your assessment in the home, to see what type of care was going to be needed. They're the ones that are going to be in the office finding the caregivers for you too, which is, it adds a whole another level of accountability. Like when you actually go see a family and then you're in the trenches fighting to find them a caregiver. So that's a really nice piece. That doesn't happen everywhere.
So another way to get quality care, either in your home with people you've hired or agency folks or at an assisted living facility, nursing home, be there. Random visits, unscheduled, not every Tuesday at 10 o'clock, but just show up unexpected. Those are the people who get the best care, whether it's a $10,000 a month facility or a $2,000 a month facility, it doesn't matter. The people who have visitors, particularly random, get the best care. And you can observe, what are they doing when you come in the door? You know, why are they in the kids' room playing with the Sony PT, what is it called? Player?
PS3?
PS3, okay, Xbox. I know Xbox. You know, they shouldn't be in there in the first place. And if it disappears, you know, now they're a suspect.
Right.
So random visits, I can't stress it enough. Don't have a regular schedule. If you're in when they're not expecting you, then you really get a picture for what's typically going on when you're not around. Okay, back to you.
No, yeah, I mean, awesome point there. We, as an organization, always want to see how we're doing and, make those calls to you guys. I mean, we'll go ahead and do the observation calls and the observation visits. We have a nurse that does a 6-month required observation visit, but because we're home care, we're not an actual facility. We're not obviously in your home all the time. So that's a great point right there.
Yeah, great point.
Jimmy? Yeah.
Yeah, Papa John's sponsored with, man, what is that? 20 pizzas, 20 large pizzas. So definitely a big shout out to Papa John's. Thank you very much.
It smells good in here.
It smells really good.
Don't wait till the presentation's over, please. For those of you who are in the room, enjoy. For your webcast attendees, come in person next month.
You got another question right here?
One of the things that concerns me.
The pins and also my list.
Yeah, we have you on the agenda.
What's that?
We have you on the agenda. Not right now.
Oh, okay.
Okay, go ahead.
Yep. Oh, we got
One
a
of the
question.
things that concerns me right now, because so far Jim's still walking and the care is is light and whatever. However, he can't drive because his head is too weak to turn and look. And one of the things that has concerned me is about 2 years ago, before he had any symptoms, I was kind of knocked out for about 2 weeks with an acute episode of right knee bursitis that my mobility was strictly, I couldn't drive. He had to help me, lift my leg to get in bed and all kinds of things like that. So, and it came on like boom, like with no warning. So I guess I'm concerned about being able to have access to someone who might be able to come and help now, because he can't drive and whatever that, can I call your company and say, I need someone like tomorrow? Because you've been talking about like these interviews and all this stuff, but short term, maybe a week or 2 weeks or something, if something happens to me.
Yeah, I would say yes. I think that driving, where caregivers are allowed to drive. We aren't traditionally an on-call service. The startup process, I'm going to actually let Mike run with this because he has a lot of experience with this, and I can see he wants to.
And let me just extend that a little bit. I have this fear of strokes because they kind of run in my family.
Okay.
So if I have a stroke one day, that's going to be a very suddenly too. I want someone I could call that could be called.
Yeah.
That could take up his care
Do you have
right
any
away.
ideas
So
for that?
back to the picture.
Good question.
We have families that are signed up with us that maybe use us a couple times a year when they need us. There's no obligation for a certain number of hours to use. But if you, let's say, haven't been, we haven't got a chance to do a plan of care and come in your home and really get a good idea of what you need, if you call us and need care that day or the next day, probably not going to happen because we want to make sure we're sending the right person out there for you. But if you come to us and say, hey, this is something that we may want to do or may have a need for in the future, then you can get signed up with us. And if you need somebody the next day or the day after that, or whatever it may be, you can give us a call. We have care coordinators in the office that are on call 24/7. Typically, if it's a request within 24 hours, we never guarantee that we can have somebody there because our caregivers are working with other families. They have other things going on. But I would say anything 48 hours and after, it was pretty much a guaranteed placement for you guys.
Okay, so
They do a darn good job, though. I've seen.
So we should sign up with you now. Is kind of what you're saying.
If you feel like you're going to need us in the near future, certainly do so. I mean, you can sign up with us. There's no cost obligation at all.
Okay.
And the thing is, we're not an emergency alert device where if there's something catastrophic that happens,
Right,
obviously
right.
you want to call the ambulance or 911.
Well, of course not. I
Right.
got that.
So, that's all I advise.
What about travel? Do you guys have people, like, let's say we want to take a family vacation, we've got young children.
Yeah.
Is that available?
Yeah, that comes up quite a bit. There's just a waiver that the company has that just kind of releases liability after a certain amount of time that they're technically on shift. So you're not paying for that caregiver 24/7. I know that you probably get a hotel. You'll have the care provider there for 10 hours a day, maybe 8 hours a day, and then after that time they're off the clock and can go off or watch TV or do whatever. But it's just a waiver. Any other questions out there about in-home caregiving? I know it's tough because it's, again, like we mentioned earlier, having a stranger in your house. I mean, that's the very first question I ask when somebody calls is, have you ever had an outside person other than family provide care? Because I want to get a good idea of what the level is as far as being comfortable having somebody in the house. Because completely understand that it could be pretty daunting for somebody and a particular for the family. So,
Keith.
Well, pros and cons on using Medicare, Medi-Cal. If I can rearrange my assets to qualify for Medi-Cal and get in-home support services, why should I do that, or why should I be cautious about that from a caregiving point of view?
from a caregiving point of view.
That I have experience with IHSS for the in-home support services for the skilled nursing side of things, and my experience with that is it offers financial support to families for caring for their loved ones. So you guys are doing it all day, every day. You should be paid for it. It's a full-time job. If there's a way to do that, if there's a way for you to qualify for it and rearrange your assets, I would 100% look into it because it's a service available. But as far as Medicare and IHSS paying us or an agency for the service, that doesn't happen that way. So
there's agencies that are contracted with IHSS that provides the service, except unfortunately they don't really provide a good reimbursement rate, so to speak. And obviously, if you want to retain the best care providers, you have to pay them appropriately. So a lot of times it's just tough when somebody has a certain funding source that isn't up to standard. Just know that it's just going to be tougher to fill those requests if it's through a funding source.
So go ahead and be blunt. What does IHSS pay? I mean, how bad is it? Do the caregivers get $8 an hour, $10 an hour?
Well, they have to pay the minimum wage, which is $11.50 here in the city of San Diego. It's $11 outside the city of San Diego. But I'm almost positive IHSS pays monthly, so they don't pay every week like we do. And I've heard from other caregivers that are on board with us that also work with IHSS that sometimes they could not be paid for a little while, maybe 2 months. You never know. So I'm not here to talk bad about the service because obviously it's a great service for people in need. Just know that there's some hiccups in the system, and it may not be the best option for the particular caregiver to go with IHSS as opposed to an agency where they know they're going to get paid more, they have better hours, they know they're going to get a paycheck on Friday every week. And that's the reality.
One thing I would like to, we don't have much left to talk to you about. If there's any more questions, we'd love to. But I think Maxim Healthcare has over 300 offices nationwide, so 300 different locations. If family members were to move, go on vacations for weeks at a time in Florida, odds are we'll be able to get you some services out there with Maxim. Okay, so that's definitely a huge advantage, I would say.
And it's also great because we have caregivers that move as well, and we're getting caregivers that call us because everyone wants to move to sunny San Diego, and they might work for a Maxim in Virginia or Pittsburgh, and they'll be coming over here, and we get to retain them and keep some quality people on staff. So that's something that we're able to offer not only our clients but our staff, our employees.
And our cards are on the tables. If there's questions that are escaping your mind right now that you can't think of, please don't hesitate to reach out. I love being a resource, no matter what. If it doesn't have to do with joining Maxim, if you have a question about the industry or resources, I know Keith is the same way. It's one reason why I really connect with you. So please do not hesitate to reach out for any questions related to this industry, or say, Drake, I'm lost. I don't know what I'm doing, whatever. I mean that.
This guy's an expert in the insurances. He'll fight for appeals and anything he can do for his families.
Yeah, it's tough.
That's it.
That's it. Yeah.
Excellent. Thank you.
Okay, thank you.
So we're going to continue now. Russ Seeger is here. He's got a couple of things he'd like to cover with the group, so please give him your attention.
I can't reach. Thank you. Hi, I think some of you know me. I keep a list of pals and caregivers and try to keep people updated with outings and things that we have coming up down the road, and also important information that people may have. It's only open to pals and caregivers, so there's no marketing opportunities going on. And if anybody, I know some of you are on the list, if anybody here isn't on the list and would like to get on the list, I've got a sign-up sheet here. You can fill it out. We've got 54 pals and caregivers on the list right now, and we try to get out as much as we can. There's not a lot to look forward to in this disease, and if you can look forward to having a nice outing and have a good time, and it seems like pals can talk to each other like other people can't talk to them. We understand we're all going through the same thing, and I think we all appreciate it, being able to talk to our friends. The other thing I had is you probably all know that May is ALS Awareness Month, and the ALS Association has bought a whole bunch of these pins like I'm wearing. I see Jesse's wearing one, Cindy's wearing one, and I've got a bunch of them here for sale. They're $10 a piece. The ALS Association makes a few bucks on them, but the important thing is to create awareness. Wear it and get out in public, and people may ask questions, and you'll have an answer for them. If $10 doesn't fit into your budget, Keith will buy them for you. No, I'm just kidding. I'm just kidding. If it doesn't fit in your budget right now, I'll pay for them. I think it's important to get out there. So everybody, come to see Cindy. She's got the pins. Thank you. Thanks.
Thank you, Russ. And the next support group meeting, as much as we love to be here at Life Pro in this beautiful conference room, in June we do take a break, and we assemble at the USS Midway, 10 o'clock, the fourth Friday in June, June 25th. You got to be there at 10 because by 10:15 we're all in. So if you come late, then you're getting in line and buying a ticket. But so that's the plan for June. July, the second Thursday, we're back here. at LifePros for a presentation on nutrition and diet by UCSD dietitian Kaylee. Some of you probably know Kaylee. So thank you all for today. Any final questions before we shut off the webcast and you guys can visit here without a camera on you? All right, we'll shut it down, and please stick around. There's lots of pizza, lots of fellowship, and get on Russ's clipboard if you haven't already. And one final plug, ALS registry with the Center for Disease Control. We'd like to mention that. If you haven't done it yet, it really helps the researchers. I understand it takes about 30 minutes. You don't have to do it all in one sitting. Have your loved one do it for you if that's possible. But it really helps all of us if we can all register. Okay, thank you.